Good morning. It's my honor and privilege to welcome you to yet another edition of BW Dialogue. Today we have a BW Healthcare World Dialogue, and we are talking to a healthcare entrepreneur who has a vision to make healthcare affordable, and he's toiling in that direction. She's had multiple successful ventures in healthcare, and he continues on his journey to be providing affordable healthcare to Indians. Let me welcome Dr. GSK Velu, Chairman of Trivitron, to the BW Healthcare Dialogue. Welcome, Dr. GSK Velu.
Thank you. Thank you, Dr. Annurag.
Dr. Velu, how have been the last 120 to 140 days for you personally and professionally?
I know, this you know very clearly. Nobody of us really even anticipated anything like this we'll face in our life. So it's been both in personal and professional journey. It's something very unique. I don't think we'll get such kind of experience in our life. And every day it was like a roller coaster ride. In a personal side for all of us, I think one positive thing is we all started learning how to remain in one place and spend time with the family. Past almost 30 years, I have been traveling more than 20 days minimum per month. Now this is the past 4 months, we have not traveled anywhere and we are still sitting at home or office and working on it. From professional journey, being in healthcare, I think we have been busier than ever. Because of running 24/7, running factories, or Neuberg Diagnostics setting up more than 10 PCR labs across the country, or in Kaveri Hospital dealing with non-availability of beds. So there's a lot of issues going on as healthcare entrepreneur. We are seeing a lot of traction. This is the first time I think the healthcare doctors were considered more important than Bollywood stars. So to some extent, I think we are realizing the value of healthcare during this pandemic, and that makes us feel that, okay, yes, healthcare is also getting the kind of attention it deserves. So that's the only positive thing, except that the fear still continues, though it's slowly subsiding. I think fear continues amongst the general public, even amongst, for us to run company itself. It's a very differential strategy. There are people who have to go to the location to serve, like our factory workers, our scientists, or it could be even doctors and technicians who has to go to the location to work. And there are field people, the sales, marketing people, finance people, they can all work from home. So how do we really balance these two? We found it a little bit difficult to really tell people there is a part of our team has to go to the office and work, and another part probably they are more paid, but they were sitting at home and working. So we had to really console and talk to people and say each one has a role to play. I'm very happy to say everybody realized their role and contributed during this crisis.
Thank you, Dr. JSK Velu, for making a contribution through various healthcare ventures you have. Now, for Indian healthcare to become what it should become, to be first accessible to all, second affordable for all, what do we need to do as a country to get to an coverage that is universal and pricing that is affordable? I know the government has done the Ayushman Bharat, and that's a very important step in making sure the healthcare delivery improves. But tell us, what should we do at this point to be able to catch up for whatever we've not done in the past?
I think Indian healthcare, actually you all know, all of us know that it's a dichotomy. I think only the top 20 cities has most of the healthcare facilities. To go beyond that, we still have a lot of problem. Government has enormous burden of taking care of rural healthcare, and there's not major private investments in the rural healthcare field. Till now, investments have been in the urban healthcare, and particularly restricted to top 5 cities or top 20 cities in a way. If you go to the top 5-10 cities, I think the healthcare access is reasonably good, and yet the healthcare advancement is also there. We have actually the best-in-class healthcare facilities in all the top cities. But the day we can say that we have become universal healthcare or we have become a developed nation, only when people in village gets the same level of care, like what has happened in the Western countries. So I think rural healthcare is a big, important issue we need to focus on. Even today in this pandemic, we are coming to know there is a big dichotomy. In certain cities are able to deal with it, and certain cities and towns are not able to deal with it because the healthcare infrastructure is lacking. And only the government cannot build infrastructure across the world. Till now, I think the private healthcare over the past 3 decades I've been part of this healthcare industry for 3 decades. We have seen a lot of investments are going to the top cities and possibly to some tier 2 cities. But when you go back to tier 3, tier 4 or villages, there has not been a major private healthcare. So government has to do something to actually attract more private healthcare investments in rural areas too. It is tier 2, tier 3, tier 4. More than that, even in village healthcare is very important. Then availability of medical professionals in tier 3, tier 4 and healthcare still remain a challenge. Government is coming up with a lot of plans to make it compulsory for people to do rural health assignments. So that is an area we still haven't found a full solution. Of course, Ayushman Bharat has been a game changer. To some extent, I think everybody, it's probably the world's largest insurance coverage package. But while the intent is good and government is doing everything possible within their means, but again, the problem is lack of infrastructure and lack of professionals. If you expect a person sitting in a village to travel 100 kilometers to get dialysis done or get basic healthcare done, then there is a limiting factor. The day we start looking at the healthcare as a holistic scenario, not only primary healthcare, also these chronic diseases which requires day-to-day attention, whether it is diabetes, cancer, cardiology or renal care, all these need to be provided in the rural level. So that's my thinking is we should really start in the next 10 years, start looking at how do we enhance access. And second comes affordability. The affordability, I think the Indian pharma industry is a flag bearer of showing how medicines can be made affordable. Today, I don't think anybody dies because for want of medicine. Even today, when Indian vaccine comes, I'm more than sure that it will be affordable to every Indian in the country, because that's how I think our ecosystem of pharma industry is set up. But unfortunately, medical devices is one industry which still we are 80-85% import dependent, and that's where government has taken that as a priority sector, and it's our duty as healthcare professionals to ensure that the Make in India and medical devices move forward, so that we don't start importing even basic devices. I think this corona crisis also has shown to us within 4 months we could come out of import dependency on all the corona support, focused products like COVID diagnostic kits, or you talk about ventilators today, or hand sanitizers, or even PPEs. All this, when we could do it in 4 months, if you really do in a sustained basis, not even 10 years, we just require 3 to 5 years to become import independent in medical devices. Because if you look at 4 pillars of healthcare, which is education, services, medical device and pharma, I think we have progressed in pharma and we need to do more in other 3, including, but medical education, we have started many medical colleges across the country. But definitely in services, rural health is important. In medical devices, indigenization is important. If we do all this movement holistically, I think the universal healthcare is a reality in the years to come.
And what is the role technology will play in this? In making it more accessible, more affordable, and in, say, leapfrogging in areas, telemedicine and telehealth. And
that's where India has a great advantage. We have a great communication and connectivity even in villages. Today, our mobile phone usage and internet usage is growing day by day. And I think in mobile phone is almost we have covered the country. And even internet coverage is growing up. So with that, I think we need to start using, I think the healthcare of the future is going to be delivered virtually. That's the only way we can actually ensure universal healthcare. It's not possible for a vast country like India with so much population. We can do traditional means of delivery. I think we need to start using technology. Till now, telemedicine has been more of a teleconferencing or video conferencing than telemedicine in holistic way. That means for us, telemedicine in holistic way is the devices should be connected. Yeah, the patient can just put a ECG lead and on the ECG signal should be communicated to the doctor. Or BP the same way, or the glucose results the same way. So I think that next important thing in technology is connectivity with devices. And then you interweave it with telemedicine, teleconferencing, which is going on today. I think a lot of work is going on. But I think because of medical devices still being imported, that is one of the big issues. While we have great connectivity, good amount of even teleconferencing capability, but when it comes to the connectivity with devices and accessibility to doctors in a simple way is something which we have to work on. I think that's even today, I think after this corona crisis, what I hear is the teleconsultations have gone up substantially. The doctors are doing teleconsultation as a routine practice today. all of them are now looking for even device connectivity so that they can do remote diagnosis. So that's something which we need to work on, remote diagnosis. Of course, treatment, you still need to have a touch and feel. Somebody has to access a healthcare facility. But at least consultation and diagnosis can be done in a remote basis using telemedicine techniques.
Dr. GSK Velu, I want to ask you this question. If we had to estimate the loss of healthcare revenue in two sectors broadly, one, the organized big hospital chains, big healthcare setups like you, and then is what I call the neighborhood clinics, which are aplenty. What is the scale of loss of revenues that these temples of service, I won't call them clinics, I call them temples of service, would have lost? Would it be close to 15,000 crores?
The estimate is even more. In FICCI and other associations, we are now currently estimating what it is, but it could be in that level easily already. Because if you see that there is a fear of going to hospitals. The only reason people like to go to hospital is because they are COVID positive and they need to get treatment. Otherwise, almost all the person you talk to, even NCDs are being ignored. When even non-communicable disease which needs immediate attention like diabetes, cancer, cardiology, renal care, all these are being ignored to a large extent. There is a general fear going to the hospital. You have a chance of infecting yourself. So these kind of feelings are there. So I think time has come. Maybe the Independence Day is coming. That's the time we need to run a independence from Corona fear. So I think the real fear what we are getting out of Corona has to go away. Then only I think the health indices of the country will go up. Today, I think the fear is stopping people from coming. So most of the conventional businesses, for example, our own eye care business, Maxivision Eye Hospital or Apollo White Dental, these businesses which are elective, almost we are seeing nothing, 20-30% of the original business. When it comes to diagnostics, if you go and see most of the diagnostic companies like our Neuberg and all, there's a lot of volume of COVID testing that is making us survive to some extent. In Trivitron, again, we have multiple factories, but again, the COVID supplies which is getting us going. Otherwise, the conventional businesses are down. So, contrary to the belief, the healthcare industry is doing well. Today, whether you like it or not, 70% of healthcare procedures in this country are done by private enterprises, whether it is a small nursing home or large corporate hospital. But all of them are now going through difficult period. And biggest issue in this is healthcare. I was told is probably the number one, if not the number two employer in this country. The number of people, the millions and millions of people are being employed in the healthcare industry. So unless we do some kind of package to the healthcare industry and ensure that their healthcare should not get sick. The industry should not get sick. So it's time has come to really to do a campaign to make people not independent of business aspect. It is about people's health indices. Why I think the press has to run a very solid campaign to make people to go and take care of their chronic illness. Sometimes they will have more difficulty out of chronic illness than they're getting exposed to COVID-19 virus. So I think it's a big loss, and it's time for us to run a campaign across the country to get people to look after their conventional illness which they have, and also get into wellness. Now we don't do almost nothing on wellness. Nobody is coming to health checkups. Nobody is doing routine checkups. Nobody means very small proportion. I think people who are otherwise used to take care of their health is now thinking that staying at home is as healthy as you can ever get. So that's the feeling which has come in. To some extent, yes, unnecessarily traveling and crowding can be avoided, but if there is a necessity to go to a hospital or get yourself tested, that should not be postponed. And that requires a push from all angles, press, government, private enterprises, industrial associations. Everybody has to do something to ensure that the healthcare comes to normalcy.
Okay, thank you for being so real about this question. You're right. The healthcare of the healthcare sector itself needs to be looked at, to be protected, and there has to be messaging so that people and the stakeholders and the policymakers understand that and implement some schemes that help the healthcare sector to be strong so that the health of the nation can be kept strong. Now, let me come to one aspect. You said people are afraid to go to hospitals, right? So tell us, what is the future of healthcare at home? What is the future of elder care? Because as the aging population grows, plus technology immersion happens, plus this aversion to go to hospital because you may come in contact with others. Healthcare at home is poised to grow. I mean, it was growing even before COVID, but post-COVID, how do you think the subsector of healthcare at home will grow?
I think when you look at, there is clearly in healthcare, there are two aspects. One is illness, another is wellness. So the illness, of course, you have to go to hospitals to get yourself cured or see a specialist. But when it wellness, I think mostly can be delivered at home or in standalone diagnostic centers. Basically where you are not dealing with illness as a focus. So if you want to go to get your X-ray done or your CT done or ultrasound done, it's better to go to an independent diagnostic center or get your blood test done rather than to a hospital. So I think there is a distinct distinction between what hospital should do, what these individual diagnostic centers or wellness centers should do. And third comes the most important aspect is the home health. The home health is an aspect which is picking up across the world, and people, when it comes to diagnosis and also management of chronic disorders, I think home health will play a very, very important role. Today, nobody wants to, most of the people still prefer their blood testing to be done at home. And even ECGs, like even in our own Neuberg, now we are offering ECG at home, and we can even do portable X-rays at home. So I think this will increase, but how much it becomes affordable, and what are the things you can do at home, what you cannot do at home, it depends on the infrastructure and affordability of different sets of population. So in the US, wherever it is, I think mainly the home health has come mostly on diagnostics. Nothing is possible except for people have tried dialysis at home. Even now, a very small portion of people are doing dialysis at home. As you say, elderly care. The elderly care is not a sick care; it's a wellness care. For a wellness care for an elder person to remain healthy, what need to be done? Our provision of nurses or paramedical staff going and taking care of their basic needs. I think the home health is playing a big role. So each sector will have its own, like pharmacy now. Nobody wants to go to a pharmacy shop to buy. So people are actually, online pharmacies become the norm, where people are just ordering medicines at home. People are ordering blood tests at home. People are even ordering sometimes ECGs and X-rays at home. So I think there will be this is a growing trend, and it will continue to happen, particularly in situations like this or in large cities where people don't want to transport and they have limited amount of time to actually speaking, that people are happy to go to a movie and spend 5 hours for that. But to spend 1 hour on healthcare, people think 3 times. Why do I spend 1 hour to go to a hospital to do that? That's So I think because what you like to do, you like to spend more time on it. What you don't like to do, you don't spend too much time on it. So I think that the campaign about keeping healthy is very, very important campaign. And that's how we all have to take ourselves. Everybody says at least do 1 hour of exercise. Second thing I think is, I also tell is at least think half an hour about your healthcare. And start doing regular testing, keep your height and weight combination, you do your blood tests every few months once. All these things has to come as a habit. If that becomes a habit, I think overall health indices of the country will go up, like the way it has happened in many European countries and some other, in Japan and many other countries.
Thank you, Dr. GSK Velu. Now, Dr. Velu, as you just referred to other countries that are advanced in healthcare. Now, we have the Indian tradition of Ayurveda, right? And we talk of natural healing, holistic healing. Tell us how India can be a leader in natural medicine, in holistic healing, in Ayurveda. These are homegrowns. And so how can India be a leader in Ayurveda? It has been a leader in Ayurveda, but make sure Ayurveda kind of spreads wings.
Sorry, I lost you.
Yoga, Ayurveda, natural medicine, all the holistic healing tools that have existed in the Indian ancient culture that have been around. How do we make sure that they become part of the narrative in the world?
I think yoga, there is no bigger proponent than our own Honorable Prime Minister. And it is, I think, the yoga has made a not only impact in India, but globally. I think I am also a big follower of yoga. At least 3 times in a week I do it. And I see a big difference. in the way your mental health and your physical health is being nurtured. So it's all coming. So I think our ancestors lived with all this. I'm sure it is probably only thing is nowadays we are getting it documented. Earlier we didn't document in a proper fashion. Once we do documentation and we start doing clinical trials, Ayurveda, homeopathy, Siddha, Unani, all these kind of alternate medicines have a big role to play. And particularly in this today's world, I think every person is following our grandmother's medicines. The immune boosters and all that, when they said to us in the past, we never listened. Today, when my grandmother says you have to do it, we do it. Because we start respecting her more than our own family doctor. Because she seems to, so I think there's a lot is there in our own Indian medicine. We have to document it, start believing it, but you can't say one is better than the other. It is complements each other. Certain things, allopathy is good. Certain things, Ayurveda and homeopathy or Siddha or any of the other alternate medicine is good. When you combine this for right kind of disorders, a combination is always better. So, but to some extent, as you say, we have ignored some of these recipes which we all had for thousands of years. We ignored it because we didn't believe in it as much we should believe in. And today, more focused by the government and by the press and other people, I think Ayurveda, homeopathy, Siddha, all of them, they have a role to play.
Yes, I just want to focus gears. I want to change from healthcare to entrepreneurship. Now, you've been a very successful entrepreneur. Tell us a bit about your entrepreneurial journey to the viewers. It's an inspirational one. And one of the lessons is in business, especially if you want to become wealthy, is when to exit, when to call the right calls so that both entering in a business and exiting a business are an art. So tell us a bit about your entrepreneurial journey.
Yeah, actually for me, I'm an accidental entrepreneur because in my family, I come from a poor family from southern Tamil Nadu, where they didn't even understand anything called business. So I actually started doing all my education almost 2.5 years ahead of my age. Because first, I went to first standard instead of lower kindergarten in a place called Chinalapatti in a village in southern Tamil Nadu. Because there was the corporation school did not have lower kindergarten. My father calibrated my age and put me at the age of 2.5 to go to first standard. So that's how I started. My life started with some amount of accident. So at 19, I started working in a medical device company. Then by accident, I became a partner with my own boss at the age of 21. Then I became, I floated a company along with my boss, and that was the first time experience. So for me, I never planned to become an entrepreneur. I just became accidentally an entrepreneur. After that, one thing which I went all through my life is I just went after my passion. I never went after the money. So like, for example, when I went to study, I went and took pharmacy, while I could have got any engineering discipline in BITS Pilani because I wanted to be close to medicine. So I didn't become a medical doctor because I lost my medical mark by just 1.5 marks in Tamil Nadu during the reservation during that time. So, but I somehow wanted to be close to healthcare all along my lifetime, right from my young ages. I wanted to be near the healthcare. So that passion got me going. So 91, I went into a corporate career for 5 years from 92 to 97, working for a multinational company. I spent a couple of years in China. That gave me a lot of idea about the medical device industry. I lived in Shanghai in those days. Then 97, I founded Trivitron. Again, because all the ideas I grasped over 10 years in working on my own as a young entrepreneur, then working in a multinational. I formed the Trivitron was formed in 97. Then I co-founded Metropolis in 1998. So those two are the businesses which grew parallelly. Until in 2015, I was forced to exit Metropolis. So then 2015, I exited Metropolis and again started after my non-compete 2017 Neuberg. In all these businesses, I just had the 3 principles. I call it as a BP control: belief, positivity, and commitment. If you have these 3 things, you can do whatever. So if you say positive and you are passionate about something, you can keep doing. So as an entrepreneur, basically it is about belief. Usually you go back and see any successful entrepreneur is a belief which gets him going. Then he has a passion. Then he commits himself to that passion. Then the success automatically comes. Like my business has not been always successful. We went through, like for example, 97 we floated Trivitron. Almost in 2000 it was bankrupt, and we have to start all over again the business. So we kept on changing the business model, because Trivitron initially was started as a distribution company, then it became a manufacturing company, then became own innovator. So it all goes through a journey. Even in Metropolis, when we started, it started from one lab to become multiple labs across the country. So, and all these businesses have just one central principle. I thought if you want to do multiple things, I had somehow had this feeling. People ask me, why do you do so many businesses? Why can't you do one well? Because every entrepreneur is made out to be something. So for me, I said, when I do, what is my common principle? The common principle of doing business is partnership. If you go back and see, in every business, I have got partners. And I had, except in one or two incidences, I had trustworthy partners. I have been nice to my partners. They have been nice to me. This is how we built Trivitron, we built Maxivision, we built even Metropolis at that time, or now Neuberg, or Apollo White. Any of these businesses, we actually went through partnership. So then when you have partners and start having complementary skills, you can do this business well. When you want to do all on your own, you can do one well. But we actually go ahead and partner with multiple people. Your growth is faster. In multinational parlance, they call it as M&A. In my parlance, I call it as partnership. Because always we don't buy business fully. We always buy it partly. Unless the partner after 5-7 years wants to get out of the business, we continue on a partnership model. So this is how we are able to do multiple businesses at the same time. Though my executive time I spend mostly on Trivitron, and a limited amount of time on Neuberg. Everything else is run by the partners. I just provide vision, some level of marketing inputs, strategic guidelines in the board. This is what I do in all the businesses I'm involved in.
Thank you so much. And if I may ask, what are the top 3 learnings of being an entrepreneur? What is your piece of advice to young entrepreneurs who in this period of uncertainty are looking for hope and are looking for advice to be successful?
No, I always say for any startups or anybody, being unique is very important. I think what works for one person will not work for another person. So sometimes when you try to copy what others have done, I think the success possibility is much lower. So you need to have your own unique proposition. What is that you are bringing to the market? What is that? Always it is meeting a demand. So you have to find that unmet demand in whichever place, whether it is going to be in a city or a village or in a country or globe. You have to find that unmet demand, then start addressing it. Whenever you try to address it saying there is already a demand, so I'm going to do it cheaper than him or better than him, sometimes it's difficult. So even within the overall, it may look like the same field, but you need to come up with what is your unique selling proposition of your venture or your product. So that's always important when you try to do a business. That's the first experience. Second is, I tell to all the entrepreneurs, nothing can actually replace hard work. You can't become an entrepreneur and stop working. Saying somebody, I become an entrepreneur, I put a CEO or I put a team, they will do. Unless you are a team player, you can't be a non-playing captain. So if you are actually not playing, sit there only be a referee or a judge, but you can't be unless you are a captain, you can't win the game. So you have to play with your team. And the third important thing is whomever you do, whether you are a small one-man show or a 100-man show, I think most important thing in business is people. If you are a team player, and if you are able to take care of your team well, then probably you will succeed. These are the 3 advices I give it to every entrepreneur.
And what is your advice on exit? In a business, if you're looking to exit, what are the factors you must keep in mind? Again, all these are, not everything can be planned, right? A lot of it's serendipity. You said you're an accidental entrepreneur. I use the term a lot myself. So tell us, in exit, if there is a playbook, is there a playbook for exiting a business?
Yeah, it depends on what business is it. Say I have a small, in which I am an anchor investor in a private equity business. That is where I call, that should be left to financial specialists. Like I don't interfere in that business at all. I'm just an investor and a GP and LP in a small private equity business called Stakehold. I don't interfere because this should be left to financial scientists. That's how I call all these PE specialists. They know what to do. They go very, very deeply about scientific analysis, when to enter, when to exit. They look at the market factors. Those are specialists, financial specialists who has the capability of estimating entry and estimating exit in a reasonably good fashion. Even they actually, like for example, nobody would have predicted Corona. Even the best of prediction wouldn't have come in. So this is, in my opinion, maybe you can get it 70% right, or 60 to 70% right, your entry and exit. Rest goes by accident. But an entrepreneur, you don't enter into a business to exit. You enter into a business because you are passionate. And the exit happens because the day you exit, because you think I'm not adding any more value to this business, or be making, sitting there is going to create more trouble for me or the company than for anything else. Like what I did in Metropolis is the same thing. It is not that I wanted to exit Metropolis. The situation was created in which I think it was better for me to exit rather than being there and sulking. So sometimes it is compulsory for you to exit. Sometimes it's planned to exit. But I don't think an entrepreneur ever can plan exit that well. A financial specialist can actually plan well because they have no emotions. Every entrepreneur is emotionally involved in business. If you have emotions, then you need to be an entrepreneur. Then only you can be an entrepreneur. But a PE business or an investment business, there you go in as an investor, then you keep on looking for the right opportunity to exit. So that's the difference. We can't combine an entrepreneur's exit with a PE or a financial investor's exit. These two have different connotation, and as a financial investor, you should be non-emotional. As an entrepreneur, you have to be emotional. Then only you can run a successful business.
Beautiful. So financial investors can be business-like, clinical, only focused on the numbers, whereas an entrepreneur is also passionate and emotional about the nature of the business, and that's why he or she is able to build a business. So beautifully explained. Let me change gears. At a very young age, you achieved success. You already exited successfully out of business. You built a fund. You are active healthcare businesses. So you've done it all. What else is left for Dr. GSK Velu to do? If at all, is there a bucket list? You can share it with us. But I know you have a long way to go from where you are in your own mind, though you achieved a lot. But tell us, what is the direction you'd like to take over the next 5 to 10 years?
For me, this is just the beginning of the journey. In my opinion, I don't call I achieved anything because I'm not calculating my wealth. I actually calculate my success based on what our enterprises has achieved. So if you really see Trivitron, it has gone through a lot of ups and downs, the roller coaster ride, because it's a Make in India agenda. So we would like Trivitron to become one of the globally acclaimed medical device company, like what pharma companies have achieved in India. I think now this Corona crisis also have shown that Indian medical devices companies can become globally competitive, and they can become large. So our idea is to, in the next 3 to 5 years, take Trivitron to a global scale and list the company, is which we are looking at in Trivitron. Despite all the challenges we face in the short term, in the longer term, I still believe it is a company very close to my heart, and I would like to, see it becoming a global company. As far as Neuberg is concerned, it is exceeded my expectation. We just started in 2017 October. Not even 3 years, we already become the 4th company. Hopefully this year we will even reach more than 800 crore revenue and possibly 1,000 crore revenue next year. So this is even less than half of it. We would have been happy if it has happened in Neuberg. So that, I think, again, Neuberg at some point of time in next 2-3 years, we would like to list the company. So these are the 2 companies which is basically close to my heart. Everything else, I consider myself as an investor, whether it is in Kaveli Hospitals, Maxivision, or I have this Apollo White, Apollo Dental. I'm just adding value. I'm not running those companies. I'm really run by very good professional CEOs, RMDs. They are all running those businesses. I am adding value by providing some strategic guidelines. In some businesses, I'm like Kaveri, I call myself as a mentor and director. In Maxivision, I don't do nothing. It's just my CEOs and the doctor there, our co-chairman runs that business. I'm just supporting them whatever time they ask me. And Apollo White and Apollo Dental, I consider as a privilege to be just partnering with Dr. Pratap Reddy. So he was like my role model and mentor. So when he invited me to partner in a venture, I consider that as a privilege, and we do whatever we could do. So all these businesses, that is Apollo's business, I'm just giving some guidance and support. So each business has its own connotation, but almost even today, 70% of my time I spend in Trivitron. Another 20-25% of my time I spend in Neuberg. Less than 10% of my other time I spend in other businesses, just giving some guidance.
Okay. Let me ask you my last question before I bring in one or two audience questions. My last question to you is that if you look at the Indian healthcare sector and we look at the various specializations, we look through the value chain of preventive, surgery, and then there's the, you look at areas like, dentist clinics. Tell us, where are the opportunities in India? You have already talked to us about the huge opportunity in semi-urban and rural India, where healthcare is under-penetrated. So anybody who is able to build quality healthcare there will be somebody who will build some value. But tell us, for example, you talked right at the upfront that a lot of people have stopped going to hospitals. People are not coming to dentist clinics. So those kind of practices are suffering temporarily. But in the medium term and long term, what are the opportunities in Indian healthcare that are there to be explored and grown and taken?
I think number one is technology. That's where I think how do you disrupt technology so that the healthcare become accessible and affordable. That's what I get really enamored with what happened with mobile phone or internet. So we need those kind of disruptive ideas so that healthcare can reach every home and every human being. So, but for that, I think cost is an important element. If mobile phones were initially, having a mobile phone was a great prestige. Today, if you don't have a human being, mobile phone, you're probably not a human being. So, same way, why should healthcare not reach every human being? So, I think the healthcare technology is the biggest disruptor. I think all these big companies are looking at it, which is Google's and Apple's and all of them. That is a rich man trying to do something. So, obviously, he'll come with rich solutions. If we can come with poor man coming, a rich man can never find a solution for a poor person. So now a developing country like ours need to find our own technology disruptive solutions to reach healthcare to every home and every human being. I think that's the biggest opportunity which we face, and whether it could be connectivity-based devices, it could be artificial intelligence-based, big data analytics-based. A lot of things are happening, bits and pieces. Anybody who is able to put it all together and do it in a very cost-effective fashion, that is the biggest opportunity, the technology disruption. Then what you are talking about is obviously, in my opinion, the second big opportunity is also the rural healthcare. But it is a challenge today, not because delivering healthcare is so difficult, but no medical professional or paramedical professional want to settle there. So they don't want to settle there because there is no good schools, good education, good infrastructure. So it's all coming back to economy. Once we start getting from urban economy to rural economy, where our living in villages is as good as living in cities, like what happened to Europe. You go to Switzerland, you go to Netherlands, any of these people live in villages because they feel the infrastructure is even better than cities. So I think developing rural infrastructure and making these medical professionals moving to those places to settle is the most important thing. And even people facilitating that, creating rural healthcare infrastructure is a big, along with infrastructure does not mean just building a hospital. You need to create, the entire ecosystem surrounding that. How do you ensure that the doctors come there and live happily? How do you ensure that the paramedicals come and live happily? How do you integrate education into that? So this whole concept of holistic healthcare, entire ecosystem coming into rural healthcare is a big opportunity. But unfortunately today, if you put a business model, rural healthcare is not attractive. So this is where governments have to come. They came up with some small concessions. I think government has to come like what they are talking about medical devices parks. They need to also talk about this holistic healthcare parks in rural areas, where it will provide everything what is required for a healthcare ecosystem to grow. A medical college, a medical device manufacturing, diagnostics, hospitals, everything coming in like a cluster. The parks where the entire holistic healthcare is provided, not from the angle of only healthcare hospitals, but also from the angle of taking care of healthcare professionals to migrate from cities to villages. That's very important, in my opinion.
Thank you, Dr. GSK Velu. Before I ask you my last question and bring in my colleague Kavi Bhandari, my last question is: we're talking 4.5 months after COVID hit the country, and last 4.5 months have been a seesaw battle between lives and livelihoods. There is a hope that a vaccine will come very soon. Tell us, what is your personal view on where is COVID headed and when will we get the vaccine?
I think we all know, but the question is when we will get. Most of the people know. I think people are saying before US election there should be a vaccine. So we don't know. I'm sure there is a vaccine coming, but how efficient?
And Donald Trump will take credit for it, right?
Yeah, but he definitely wants one. So we would definitely have a vaccine soon. But how efficient it is, the efficacy of vaccine is yet to be seen. Because we have seen like influenza in many places, a lot of vaccines have come. But that was not a cure-all strategy. It can work on certain portion of the people, or it could be yearly vaccine, and how many people can afford it, get it, how efficient. So that's going to be a debate going on for a few years. But independent of waiting for vaccine, we should all learn to live with corona, when COVID-19 as a virus. Now we have seen in India, at least some amount of speculation is coming true. The Indians are more immune to corona than others. Our fatality is low. The number of ventilators we required in our country is far lower than the Western world. So from that angle, I think it's better to move on. We need to take precaution, no doubt. We need to put the mask. We need to keep social distancing. We need to do sanitizing. All those SMS concept has to be kept. But beyond that, I think keeping our lives away from day-to-day life and not taking care of basics is going to be a problem. So starting from this Independence Day, I'm sure even our Honorable Prime Minister will be saying the same, saying that we all have to move on with our life, taking adequate precaution. So I think moving forward from next quarter, the economic activities has to come back. I think the mysteries or miseries which is being created out of non-economic activities is going to be more than the miseries being created by Corona itself. So it is important that we move on with the economic activities rather than over-emphasizing on isolating ourselves and keeping it. It's important. Saving ourselves is important, but completely stopping all economic activities, I think that phase is over. It's time for us to reboot and start going back to do our own normal life.
Okay, Dr. GSK Velu. We'll take some audience questions in a while, but Kavi wants to ask you a question. Go ahead, Kavi Bhandari.
Thank you, sir. Sir, in your article, Key Ingredients for Organizational Change, you have said that a clear vision is essential to begin change. So I want to ask you, what is your overall vision? When will you be satisfied that, okay, I have completed my vision?
I think in an entrepreneur journey, your vision, as you complete something, something gets expanded. So there's nothing called stopping, but that is the reason the bigger vision of our companies always is about enhancing access and affordability to healthcare, which is basically the overall vision of most of the companies we have done. There is no quantity to it, or it's only quality to it. There is no quantity. So you cannot say, when will you say that if you enhance access and affordability in India, there is Africa which needs it, or somebody else which needs it. So the vision is to basically work with why your company exists. And any entrepreneur creates a company not for himself. It should actually exist even after themselves. Even after our lifetime, it has to do. Those are the companies which exist for centuries. So when you create a company, that's how you think. You basically think, I want to create a vision which lives beyond me. So if I create a vision which I will achieve in my own lifetime, that doesn't become a large vision. That becomes a very myopic vision.
Sir, recently FICCI appointed you for Tamil Nadu State Council as co-chairperson, and about this you said that this position gives you an opportunity to work within the FICCI framework at the level and the national level also. Sir, so what is the plan here? Like, what are the steps you're taking?
No, FICCI, I have been associated with FICCI for past 15 years. Earlier, I was the healthcare convener. I was a national FICCI committee co-chair many years. All that I have been doing. So what we do in FICCI is we just empower industries, and we also ensure that the industries get the right kind of support. So in Tamil Nadu, we are doing the same thing. Particularly during the Corona crisis, we have done a lot. Particularly our textile, many industries are going through lots of difficulties. So we are doing our best to coordinate with Tamil Nadu government particularly all the senior IAS officers, and giving the kind of support the industry needs, both in terms of policies and also it's something very simple like e-passes for operating, to very big like industrial support, the support by the government to get the industries rebooting and working. So we work very closely with my colleagues. We have multiple conveners of our panel and we have a chair. So all of us together, we meet and start supporting the industry in Tamil Nadu under the overall guidance of our National Council.
Thank you, sir.
There are a couple of audience questions. Let me take two. One is from Ajay Mutreja. He says, how can healthcare NGO, which is part of an Indian corporate serving rural and tribal population, ensure scalability with financial sustainability? And can there be an exit for the corporate?
He's asking whether the business by corporate is sustainable?
No, he's asking that there is an NGO which is part of an Indian corporate and it is serving the rural and tribal population. How do we ensure scalability with financial sustainability? And is it possible to give the corporate an exit? So it becomes so big that there can be an exit for the corporate.
I don't think so. In my opinion, I know you have all of them have to coexist. Public, private, and NGOs have to coexist. I don't think anyone can replace the other person. I don't think the only private can exist and we can give an exit to public healthcare or NGO or other way. NGOs come and take. So our India is so vast that these all the three sectors, which is public sector, private sector, and NGO sector, has to coexist if we have to provide universal healthcare to all in this country.
Okay. V. Gopinathan is asking, dear doctor, greetings. What will be the future of the Indian IVD industry in next 5 years?
Actually, this COVID crisis has shown Indian IVD industry has really stood up. There's one industry which has really stood up, and we are all proud of. Is if you remember in March and April, we were importing the COVID diagnostic kits, and the cost of PCR kits were almost close to 2,000 rupees. It has all the three components together, which is PCR kit, VTM, and RNA extraction, was more than 2,000 rupees. Today, it has come down to less than 500 rupees, all three together. So this shows not only we were able to bring the price 1/4 down, we don't import anything. Almost 95% of the products which is used in this COVID diagnostic kits are all manufactured in India. So this is scope. If this is a trial, I think Indian IVD industry has a long, bright future, like what pharma industry did it. We should have done it earlier, but maybe a crisis like that had to come for the industry to really recoup and start realizing their own value. Today, we have seen the value of the Indian IVD industry, and it is here to stay, and it will start dominating the way not only in India but also in many of the developing world, like the way our pharma industry did several years back.
Okay, let me ask you, or I did ask you this, and you did. Is there a bucket list you had, and if yes, what is that bucket list?
No, I said, the bucket list keeps changing, So basically, when you achieve an objective today, for me to list both Trivitron and Neuberg in the next 2-3 years is the immediate, bucket list for me to do. On a personal basis, I keep changing my bucket list every first year. You take 3 or 4 resolutions, 1 or 2 you do, 1 or 2 you don't do, then you do it. So it keeps changing. So I don't think I have a fixed bucket list which remains the same. But one thing is, it's mostly about thinking about my enterprises to make some changes. Financial objectives are there, but more than financial objectives, the social impact which your brands can make makes me feel more proud and happy.
Thank you so much, Dr. Krishna. We wish you luck in your noble mission of building healthcare capabilities. Building companies is an accidental part of it, or it is the collateral benefit of that. So we wish you luck, and we look forward to having another conversation with you soon when you achieved some of the milestones you've led as a target for yourself. So we wish you luck, and I'm sure our viewers and our readers will get enthused by your own journey of what you've achieved and what you continue to be involved with. Thank you.
Thank you, Dr. Annurag.
Thank you.
Thank you, Dr. GSK Velu, for joining this BW Healthcare World Dialogue. Thank you to all the viewers. This content will be on the Businessworld bw.in, businessworld.in site. This will be on BW HealthcareWorld.insight, and it will be in the BW Healthcare World magazine and the Businessworld magazine. So thank you for providing us rich content and your perspectives. We wish you luck and we'd stay in touch. Thank you, Dr. GSK Velu.
Yeah. Thank you, Dr. Annurag.